Well, the Nigerian Union of Allied Health Professionals has called on the federal government to implement the high-level body technical committee's report on the adjustment of the consolidated health salary structure to avert a resumption of the recently suspended industrial action by joint health sector unions. Well, the association is also demanding that the appointment of a chief medical director or chief executive officer should no longer be restricted to medical doctors alone, but be thrown open to enable other health professionals to compete. Now, it also said that board representation for other healthcare professionals should be increased from 1 to 8 out of the 14 members, and the position of chairman of medical advisory committee should no longer be appointed from the university, but among substantive directors or deputy directors in teaching hospitals, in line with the public service rules. Now, one quote outlining their demands may suffice to be stated here, and I quote, "The 36 state governments and FCT must implement the new hazard allowance for all health workers in their respective state health institutions. All outstanding salaries owed health workers in Abia, Imo, and Rivers states must be paid to avert the declaration of trade disputes in those states, and there must be an immediate recruitment of health professionals to bridge the human resource gaps created by brain drain." These demands, do they seem tough? I don't know. Oh well. I have with me in the studio Dr. Olawale Olatubi.
Thank you.
Good morning to you.
Good morning. Good morning, Mr. Moses.
You look extra fresh this morning. Planning to go on strike? Are you getting ready for the strike?
Not yet. Not
Okay.
yet.
Now, do you think that these demands by the Nigerian health workers are reasonable?
Yes, to an extent, they are reasonable. They're reasonable because the major thing they are fighting for is, apart from the salary structure, they're fighting for equity in the health sector.
Okay.
Because they're fighting and saying, okay, at least we are all working for a same goal. And what's the goal? To make sure that our patients get well. So those are just fighting for is, okay, at least we should be, they've been sidelined too much in the health sectors. So they feel like, okay, they need to at least be in the front run and start making decisions, being in the decision-making committee. In that way, it will help the association, the union itself, and to help other professionals. So I think, in a way, it's a fair request they're asking for from the government. And apart from the salary, I said the salary structure is the major thing, actually, let me not lie to you.
Okay.
Because they've been on these things for a very long time. So I think...
What's the salary structure like?
Okay.
Give us an idea.
In 2009, there was a protest. There was an agreement between the government and the health workers. That's what brought about coherence and comments. That's consolidated health salary structure and consolidated medical salary structure. That's the medical salary for just the physician and the dentist.
Okay.
Then other health workers have their own salary structure. But apart from that, they have an agreement that after every five years, there's going to be a review.
All right.
Which expired 2014, if I'm right. Yeah, 2014. Now, since 2014 till now, that's over 9 years, there's not been a review of the salary structure. And that is why every time doctors go on strike, health workers go on strike, the major thing they are striking for is a review of their salary structure. Because there was an agreement in 2009 that after these 5 years, we'll make a review. Imagine the same salary structure since 2009 until now. The economy is bad. And things are not going on well. So that's why most doctors are even going out of the country to get better money. So the salary structure is one of the major things that is causing these rifts between physicians, dentists, and even all the health workers at large. And the government.
Now, so do you think this administration can deliver on these demands?
The problem about this thing that they also had a meeting, that's the joint health union, had a meeting, they wanted to go on strike, I think around May or something. They had a meeting with the Ministry of Health, and they had a meeting before they go. They gave them 14-day ultimatum before they go on strike. And before the 14-day ended, they had a meeting. during the meeting, just to make sure that this thing is actually during the meeting didn't come to a good end, because the party that is fighting with the health worker, that's the Ministry of Health. Ministry of Health came out to explain that they are not working on the salary now. Okay. And the health worker said, okay, we cannot be talking together. We need to have the involvement of the Ministry of Labor in. So you cannot be in this conversation. You cannot be in a conversation where you've already said you're not working on it. That's why the meeting came to without any agreement. So then the government, the past government actually, the first Minister of Labor, Chris Ngige, Dr. Chris Ngige, promised the doctors and promised everybody that, okay, they will form a committee to work on the salary structure. But it didn't happen before they left. So I think this new government should work on this to put it as their major priority.
Okay, so he made a promise, but unfortunately they were not able to work on it.
Yeah, I think in around December last year, he made a promise when he visited the NME office in I think in Lagos.
But now that he's no longer the minister, and shouldn't we wait until ministers are appointed before we now revive this conversation?
Yes, I think we shouldn't wait, because
we shouldn't wait
because the ministry is actually working regardless of having a minister. There are other people in the Ministry of Health, other ministries. So it's better they should table their matter now, so that they should know how important this matter is to the government. So that when they even appoint a minister, the first thing the minister should be working on is how to make sure that the welfare of the healthcare workers in Nigeria should be taken care of.
One of the things that health workers have been talking about for a long time now, but let me just limit it to the COVID-19 era, has been the issue of hazard allowance. I hear it's 5,000 naira.
Yes, it's 5,000 naira. Hazard allowance is 5,000 naira. I think they just reviewed it now.
Hazard allowance. Now, for the benefit of those that may not know,
okay,
explain to us why there was a hazard allowance in the first place.
Every professional that is exposed to any work-related hazard is entitled to get an hazard allowance.
And the hazard can cost the life.
Hazard can cost a life. So if, for example, now the doctor is trying to administer injection, and the injection pricks him, it's an hazard.
And he can develop.
And some infection and everything.
And maybe die.
So
and then they're giving 5,000 naira.
It's so sad when this thing had been at that time when they had this agreement. 5,000 naira was a bit something. It was something then.
What time was this, please?
I think it's been a long time, but
okay.
It was at least okay. It was a fair enough something. Okay, but this is 2023.
Now the hazard allowance is paid monthly.
It's paid according with the salary. It's paid with the salary.
Along with the salary.
Along with the salary. Okay. It's a monthly basis. Okay. But I think it's only Lagos State that is actually paying the new hazard allowance.
Which is?
I think it's 15,000 naira now.
Okay.
I think it's 15,000. So it's only Lagos State that is paying the new hazard allowance. I think Abuja, I'm not sure, but I'm very sure of Lagos State. So another thing they're demanding for is that all these new hazard allowance, all the 36 states should implement it. Then we can start from there. One of the major problems the healthcare sector is facing in this country is one, poor funding. They are not funding, the government is not funding the health sector, and there is no proper working environment. When you go to the theater to work and you see that there is no lights, no enough equipment, doctors, that's why doctors even probably is even hindering their work to even perform well. The salary structure is poor. That's why you see doctors even go through doing private practices, because they get more money in private practices, and the government that is paying them, the hospital patient that comes to the hospital don't get the required treatment they want to get, and it's increasing the high rate of mortality in our government hospitals, because when you go to government hospitals, the high rate of mortality there is very high.
Because there's disregard, because after all, they're not getting proper pay.
People will say when you go to the hospital, those doctors will not attend to you, where they're nonchalant attitude. Well, they're nonchalant attitude. I don't blame them in a way, because they are not well paid.
But then they swore an oath.
Yes, please, they swore. That's what they've been using to bamboozle the doctors. Like, okay, you swore an oath that you have to take care of the patient. You have to take care. Fine. Apart from swearing an oath, you need to take care of yourself. That person will chop, now they live. See, if a doctor cannot take care of himself, how will he be able to take care of his patients? If the doctor has not eaten in the morning and afternoon or night, how will he be able to take care of his patients? So the medical doctors or the healthcare workers need to be properly taken care of. They are essential workers. They are not just anyhow workers. Apart from the medical practitioners, all public servants, police officers, teachers, essential workers need to be well attended to in this country. And the international people are actually using it against us, because first it was the doctors, the health workers that was going to the UK, and now they brought in the teachers, because they know that these essential workers are underpaid in the country. So they're okay, yes, let's bring in the teachers. And the teachers are going to attract them. And the major thing everybody is looking for is money. Why are we working? Most apart from the passion of everything, we need money to take care of ourselves. We need money to take care of our family.
Now, from all indications, we can see that health sector seems to have been marginalized over the years, in that only doctors are given leadership positions. Now, do you think that this demand is a conspiracy against doctors by other health professionals in the sector?
I think in the health sector, other health professionals get like 95% of the workforce in the health sector. So, and the fight the doctors are fighting is this, not a fight actually. What they're actually saying is that, okay, we spent 6 years in university. Other health workers probably spent 5 years. So that 1 year gap, you must give us respect. And so if you want to earn it, if you want to get the respect, you have to fight for it. So that has been the difference. And that 1 year, the physicians and the dentists are saying, okay, no, that 1 year is a senior, we must give us that regard. And the other healthcare workers are saying, no, the aim of everything is for us to give the patient a quality healthcare service. Without us, you cannot work.
You can't work, yeah.
So you actually need to get, imagine in a board committee, only 1 out of 14 is represented in medical board committee.
One what?
One healthcare professional. So that's why they're fighting for 8. Are physicians or doctors, are physicians or dentists. So this is what they're actually fighting for. That okay, let's increase now. The Minister of Health should not always be a physician, not always be a doctor. Like no, other healthcare workers that are actually experienced in administration, that actually the nurses, the physiotherapists, they are medical lab scientists, they are radiographers, that actually can be a Minister of Health. It shouldn't be only physician. That's what they're actually fighting for. And the doctors are saying, no, we must give us this respect. So the major problem now in the health sector is that there is a rift in seniority. They are looking for, okay, yes, I'm senior than you.
Because I spent more years.
Because I spent 1 more year than you. Fine.
But what's your personal position on this? Do you think, I mean, you are a doctor, so you spent the required amount of years. Do you feel superior to other health workers?
Obviously, there's superiority.
Do you feel so? Do you have that superiority air around you when you go to the hospital? Do you think you do?
It's a subconscious act, actually. It's a subconscious act, actually, but you don't know how you put it out, but it's subconscious. You know, you just have to you look down on them in a way, but in a way it shouldn't be so. Okay. It shouldn't be so natural. It shouldn't be so. We are all working towards a major goal, and what's the goal? The goal is to make sure that we get the patient's health is very, very important to us, and get the required attention. So we should forget about the rift and focus on this, and the government should work on this, on making sure that the healthcare workers, and generally, I mean healthcare workers now, the doctors, pharmacists, everybody are well attended to.
This is not just this particular one now. It's not just on the table of the government now. We might have physicians and doctors speaking against this, saying no, we shouldn't. I mean, you can't relegate or you can't deprive us of our positions just because other health workers, whom a lot of doctors have looked down upon subconsciously, as you have said, you can't say, okay, now let's bring them to this same level. Let's give them more slots. So now it's going to be doctors, physicians, speaking against their fight for more attention.
It has always been like that.
It has always been like that.
It has always been like that. That is what is actually causing one of the major problems in this country, in the health sector. If the physicians and the dentists comes out and say, this is what we want, the healthcare workers will come back and say, no. If you are giving them, you must give us. You understand? If the government attempts the healthcare worker, the physician will come back and say, you've given them, you must increase our own too. So it's even making the government not even know what to do.
That makes it even difficult. For government to attend to.
Now, why is this rift coming up from the healthcare workers? Is that okay? Now the government is actually working on increasing the salary structure of the medical doctors and the physicians and dentists. Now the healthcare workers are saying, we are here. We both signed this agreement in 2009, so you cannot sideline it, because the agreement was both signed in 2009. The comments and the coins was both signed in 2009. So you cannot say because some people are actually having more power in the house, you must know. You must carry both teams along.
Now, if these demands are met to a reasonable extent and the general benefits of workers are raised above average, now, do you think that this would encourage more health workers to stay back in the country as against Japa?
Trust me, to encourage.
Oh, you think?
It will. See, I don't work in any government hospital. Why? Because I feel the pay is not really what I should be earning. Yes, that is because if I look at the pay in any government hospital and comparing to what I'm meant to earn as a medical practitioner, it's well beyond the pay. So there's no way. So if the government hospitals are being increased in their salaries, more people want to go there to work and get paid. More apart from even getting salary pay, their welfareism is being attended to. Other things are being attended to. Then they will stay.
I recall that some time back you did say something about some of your friends asking you, why haven't you made plans to travel?
You see, the problem about it is that in Nigeria now, they are now looking at it. If you have not jackpot as a doctor, you don't know what you are doing.
That's how it is now.
That's how it is now, because they look at you and
amongst the doctors.
No, amongst people, even your family members. My family members look at me and they'll call me like, Wale, what are you still doing in this country? I know you. Can you go and travel and do what you do well? Or your friends are going. Why? So it's like a normal thing now that you must jackpot as a doctor. As a medical practitioner, you must go. It's a very sad story.
It is a sad story.
It's a very sad, because now they look at you and they look at that. So you've not. I can tell you in my class, I can tell you that 70% of my classmates are all jackpot.
70%.
70%.
That's the brain drain that's where we're speaking about.
We wanted to have a reunion in my class that time. Like, okay, let's have a reunion. And we check all of us that are in Nigeria. We are not up to. We're not even up to 2/3 of the number. So there's no point of doing a reunion. So I still say, okay, maybe next reunion should be in the UK, because you understand. So it's sad that doctors are going out of the country, and it's becoming a norm. And why are they going out of the country? Because they are getting better pay, they're getting better environment to work with. And you see, Nigerian doctors are one of the best doctors over there, because with the kind of knowledge we have in this country, getting the proper environment to work with, we work excellently well. That's why you see, they don't want to leave us. If you go to any hospital in the UK or anywhere in the world, if you see any Nigerians there, check them. They're always doing well, because of how the passion Nigerians have for this healthcare work. So the government should work on these things. It's been too long. Work on the salary, apart from the salary structure, review this health sector, give more infrastructures, more funding to the health sector. The working environment should be okay. Doctors will be proud to work.
Right, but from what you know so far of this administration, do you think this strike will see the light of day?
I think it should, but I know the present administration have a way of making them understand some things, and I know it won't get to anything. But I understand what they had a conference. That's why they had to put out their grievances. Because if they don't put it out now, it will be until the next conference. You understand? So that's why they quickly had to put out their grievances now. So this administration should quickly work on it.
When is the next one?
The
conference?
I think it's every year. The conference is every year for healthcare workers conference. I think they had one last week or something.
Okay.
That's why they had this communicate house.
So it's always in July?
Yeah, July also.
Okay.
So, but there are other all healthcare unions have their own conferences. Okay. GSO have their own coming up and everything have their own. So, but the federal government should please work with these medical practitioners to make sure that these salary structures and everything they are being asking for it's for the benefit of the country. If these things are worked for, the healthcare sector will be okay. The politicians will not even have to travel out of the country for medical attention. It's a slap on our face. You understand that even our politicians don't even trust the healthcare sector they are investing in. They rather go out of the country. I can tell you, if they go out of the country, it's Nigerian doctors that is even attending to them.
That will still attend to them.
So why can't you just invest in this healthcare sector? I can tell you for free that it's not only in Nigeria. I was watching the news 2 days ago in Kenya. Kenya too are actually protesting. So actually, majorly in African countries, most African countries actually their health workers are well underpaid.
Okay.
And these European countries are using it against us, coming to Africa, bring our doctors and healthcare workers, taking them there to work over there because what we need is money.
Indeed. Well, we do hope that this doesn't see the light of day, because if this does, it will affect the common man.
Each time there's a strike, even if it is the normal cleaner, the people or the janitor in the hospital that goes on strike,
it affects.
Everything is down. Because without those cleaners, nothing can be done in the hospital.
Wow.
Nothing. So everybody in the healthcare sectors has a role to play, and they are important. So
everyone is important.
Everyone is important. So they should be attended to. Right. If the nurses say they are not working, that's even the worst. If the nurses say they are not working, that is all. That's the end.
Well, let's start with people like you. Stop looking down on them.
No, actually, we don't look at our people. Issues we don't. It's not.
All right then. Thank you very much, Dr. Olawale Olatubi.
It's my pleasure.
Thank you for coming on the program. Well, up next on VOP this morning, a federal high court in Abuja has restrained INEC from prosecuting its suspended commissioner in Adamawa State. Well, stay with us as we delve into this in a short while.